Well, we're here with Miss Anita James at NYC Pain MD. Miss James, Anita is in the midst of and has treated in our office with our special medical knee pain program with guided viscosupplementation gel treatments. And she has done quite well and wanted to tell her story. So, Ms. James, tell us about your knees. When did you first start noticing them bothering you?
About 4 years ago, they started bothering me.
About 4 years ago?
Yes.
Was it an injury or something that slowly started over time?
No, it just, to me, it suddenly started. You know?
Suddenly?
Yeah.
And it progressed over time and got worse and worse and worse?
It progressed over time,
Okay.
and the right knee was worse than the left knee, and then the left knee got better than the right knee, but...
So, and now, did it start to impair your life, your ability to walk or stand or go up and down stairs, things
to
along
go up and
that
down
line?
the stairs got impaired, and my ability to walk distance got impaired, and to stand
And
for
to
long
stand.
periods of time. Yes.
So, like if you would be prepping a meal and shopping and things like that, it
Right.
would bother you?
Yes,
Okay.
yes, exactly.
And so this continued for a while. Did you try like Advils and over-the-counter medications and different
Well,
treatments?
I can only take Tylenol 500, so that wasn't much of a treatment because it felt like I was taking a baby aspirin.
So the Tylenol didn't help, and
No,
that's a
not at all,
strong
not at all.
Tylenol. Now, do you have cardiac problems, and that's why you can't take heavier medications?
No, that's not why. I have allergies.
You have allergies.
To those medications. Yes.
Okay. And did you try anything else?
I tried
ointments?
heat. I tried ointment, Bengay. I tried the heating pack. I tried ice, everything, and it gave me a little relief while I was using it.
Mm-hmm.
As soon as I stopped using it, the pain came back.
Got it.
Yes.
Okay. And then you discovered our facility.
Yes.
And you came in for a consultation. You came in for that free screening process where you
Right.
offer the evaluation.
Exactly.
And at that time, what happened? Did the doctor ask you lots of questions or take us through that?
The doctor did the x-ray first.
Mm-hmm.
Then I had the consultation after the x-ray.
Okay.
And they showed me exactly how the bone was rubbing on the bone,
Okay.
exactly where the inflammation was in both knees.
Right.
And we decided to go with the treatment.
Okay.
Once the insurance approved it, of course.
So they did a good job explaining it. They
Yes,
were
very
clear and they
thorough.
made it understandable. They didn't do the doctor
Very,
heavy
very
scientific
thorough they
talk.
were, yes.
Okay. And so they had recommended what? They recommended the special gel treatments?
They recommended the gel treatments, yes.
Okay. And how was the procedure? Tell us about the procedure, how you experienced it.
Okay. I was a little nervous because of the injection, you know, the needle and all. But first he checked for fluid in the knee.
Okay.
I mean, first he numbs it with a spray, with a
So they do the free spray, and then he gave you a little of the dash of the lidocaine, like when the dentist numbs up
Right,
your gums,
exactly.
right?
Numb
But he
the
did it
teeth.
for your knees.
Yes.
Okay.
And then I checked for fluid in the knee first to make sure that wasn't causing this swelling and the pain too, the inflammation.
Right.
And then he proceeded with the injection once he did all of that.
Okay. Did they actually have to take some fluid out of the knee?
At one time they did.
So that
yes.
removed the pressure and it didn't dilute the lubricant. So
No.
now when they did the procedure, they numb you up, and there's the. Do you remember they put the special camera over your knee?
Yes, they did.
Okay. And did that make you feel more comfortable that it would be precise and accurate?
Oh,
and those
much
type of
more
things?
comfortable because I've been
Okay.
to other places that didn't use the camera. And I said, no, I'm going back here to you guys.
So let's talk about that. When you went to these other clinics that didn't use the camera, was there more pain? Did it feel like they didn't hit the spot and missed the arthritis?
It
What
felt
happened?
like they didn't hit the spot.
Interesting.
Yes, they did miss
Okay.
it because they wasn't looking at it on the camera
Right.
to see exactly how to
Right,
inject
right.
it.
And-
So, you know, when I came back here, I felt more comfortable because I
Right,
knew you all knew what you were doing.
Right. This is something we hear a lot. So now when you think about it, if they showed you that the bones were so close they were rubbing, and you just go and shoot a medicine in there without guidance, it's pretty logical. It might even hurt you, and it might damage
you missed
something, and you could miss the spot,
That's right,
Because it's so
absolutely.
narrow. So they put you under the camera, and how long does it take to get a knee injection? 8 minutes, 12 minutes, 6 minutes?
About 4 minutes.
About 4 minutes.
Yeah.
So they numb you up, they identify the space.
Yes,
They put you under the
exactly.
camera, and basically,
Yes.
they put a little Band-Aid on your knee and you go home.
That's it.
Okay.
Exactly.
But you're at least mildly active the day of a treatment, went home and relaxed? And...
Not necessarily.
Yeah, okay.
Sometimes I don't go home and relax.
Okay.
You know, I can't, but
Okay.
today I'm going home.
But the
to
point
relax.
is, the injection or the treatment doesn't necessitate you being like on bed rest or being completely out of commission. You go home and have a normal, at least somewhat active life after that.
Yes, you can.
Okay. And did you ever have any significant pain after a treatment?
There was a time when I did because I wasn't following directions.
Okay.
Yes, it was on me.
Okay.
Yes.
Okay. So now you started getting some injections, and now in the research, you've probably heard us tell you that most patients take a month or 2 or 3 to get the best results. But what was your experience? How long did it take you to get some significant relief?
After the 3rd injection.
After the 3rd treatment?
Yes, after the 3rd
So you were hurting very badly. And
yes.
within 3 treatments or 3 weeks, you started noticing an improvement.
It. Yes, I did.
And then after you finished the regimen, did you continue to improve after that?
Well, my right knee was 1.5 years before I needed another injection.
So you got a treatment here 1.5 years ago.
Yes.
And before you needed to change the oil, so to speak, or more medicine in there, you lasted almost 18 months.
That's right.
Okay,
exactly.
pretty impressive.
Months. Yes.
Pretty impressive.
Mm-hmm.
And so now are you back? Are you functionally, are you able to walk more? Specifically,
I'm off of my walker.
So you basically could throw away the walker.
I have the cane, and I'm not buckling anymore. My knees are not buckling me like that. Yes.
So prior to you starting, your knees used to literally give out.
Oh yes, they did.
And then did you have falls because of that?
There's a time I did fell. Okay. Yeah, I did one time.
So now the knees feel stronger.
Yes.
You're walking without a walker. How far can you walk without feeling much discomfort? Can you go
I don't feel
multiple? You don't feel anything?
No, I don't feel any discomfort.
So if you walked up Broadway here, you could walk for 20, 30 minutes and you'd be fine with it.
Yeah, it's mostly my breathing and that I have to stop. I have asthma. So
but that's a different
nothing
condition.
To do with my knee.
Right.
No.
How do you feel when you do things like climb up and down the stairs? Is it a little bit easier?
Much easier.
Much easier.
Much better,
okay.
Yes.
What else has changed in your life? Are you socializing more, getting out more, feel more comfortable being out on your own?
I feel more comfortable being out on my own.
You take subways time to time in New York?
I have a Cesaride, but I still feel comfortable being out on my own.
Oh, okay. If you had to take a subway, you could get up and down the stairs and things like that.
Yeah, I would be able to. Mm-hmm.
Okay. So, and you know that the office does treat necks and back and shoulders, but overall, if someone was having arthritis and non-responsive to medicines and not wanting surgery, what would you tell those patients?
I would recommend them come here.
Right.
I would recommend them come here.
Do you remember, how did you go about getting an appointment? Was it difficult or did they get
no,
you?
No, not at all. It wasn't difficult. The insurance part, and that has nothing to do with you all.
Right.
Yeah, the insurance was the most, I had to,
Right. And the insurance department was good? They verified your insurance?
Yes, they did.
And they made all the calls on your behalf?
Oh, yes, they did. They were very thorough.
Okay.
Yes.
You know, your response has been very impressive, and I think people will really enjoy your story.
Well, thank you.
I want to thank you for sharing that with us. Thanks very much.
You're welcome.
Thanks, Anita.
Sure.